Next up, we've got Mobile ODT, represented by CEO Ariel Beery. Designed to combat the barriers between people all over the world and quality healthcare access, Mobile ODT turns mobile technologies into intelligent visual diagnostic tools that allow any health provider anywhere on the globe to conduct visual inspections at the level of an expert practitioner. Ariel, you have 8 minutes on the clock. You have a clicker.
Thank you. I appreciate it. Thank you. Hi, good evening. Those were amazing. So first of all, thank you so much for giving me the opportunity to see them. And I'm incredibly excited to be here and to get the chance to meet all of you. My name is Ariel Beery. I'm the CEO and co-founder of Mobile ODT. Just on one leg, what we do is we build small, smart medical devices that any healthcare provider anywhere can use at the point of care to conduct a range of visual-based examinations, all built on the back of that supercomputer you all have in your pockets, the mobile phone. And we do that because our mission is to make visual inspection accessible to every person, everywhere, no matter their circumstances or material conditions. Our company was founded with a mission and a purpose to save as many lives as quickly as possible. We decided to go after visual-based inspections because you know better than I that too many diseases that can be assessed early, visually, lead to untold heartache, untold costs, and untold death. Cervical cancer, oral cancer, anal dysplasia, diseases that if you catch them in the early stages, you can treat them at the point of care. But if you let them progress, they become deadly and costly and challenging. And so the way that we address that is by tackling this seminal challenge that we believe face millions of Americans across the United States, which again, you know better than I do. It's lack of access to help to experts. Because even if a woman is diagnosed with a positive pap smear, many of those women will not find an expert gynecologist for a colposcopy, and her disease will progress in time to go from precancer to cancer. The heartache goes up, the cost goes up, the challenges go up. And so that lack of access to experts, which is precipitated by a lack of equipment and expertise, is something that we can and have tackled. This is the enhanced visual. This is the enhanced visual assessment system, the EVA system, used for colposcopy, ENT, oral cancer, and dermatology, all premised on the simple fact that that supercomputer that you have in your pockets has an amazing sensor array that was developed through billions of dollars of R&D. And when you set it up just right, you can make an FDA-cleared 510K medical device that can be used anywhere by anyone for those images to be captured, annotated, shared, collaborated around, and then to ensure that that patient gets the care that she deserves. And we started with colposcopy. The reason we started with colposcopy is because while for most Americans, cervical cancer is not at the top of their threat list, for too many women across America, for women in low-resource settings, for African-American populations, for rural populations, cervical cancer remains a significant challenge, costing our economy billions, but more importantly, costing the lives of thousands of women that could be saved with a simple examination. And colposcopy is not only used for cervical cancer, colposcopes are also used for sexual assault documentation and rape documentation. And the thing that connects those two is not just the device, it's that victims of sexual abuse are significantly more likely to contract sexually transmitted diseases earlier in their lives, and therefore are significantly higher at risk for oral, cervical, and anal cancer. And so by building data-enabled devices that enable point-of-care visualization by any provider, no matter the level of their clinical expertise, we can help solve that problem and ensure that women receive the care that they deserve. And to tackle that, what we had to deal with are the three challenges that face access to healthcare in colposcopy that are common across all those indications. First, most colposcopes you couldn't walk on a stage with. They're big, they're bulky, they're about 5 times the size, about a little more than 6 times the cost, and they're dumb. They have no internet connection. So the expert needs to be in the room using it in order for it to be useful. Second, most of those devices don't have internet connectivity, don't have the ability to allow people to collaborate around those images. So even if they could, they have no one to talk to. And third, there's no way to be able to ensure that patient gets to where she needs to get to. You see, because most medical devices focus only on visualization, on the tool that they're supposed to be. But we know that visualization is just the beginning of a journey. So through our cloud-based system, the person at the point of care can get support, can then refer that patient to the provider that that patient needs to see, update the patient records so that that person is not lost to the system and the next people that they get to know what they need to look for. Collect that data because cervical cancer, oral cancer, or anal cancer are caused by HPV, by a virus. And so to do epidemiological analysis on that data enables us to identify the needles in the haystack. And then through that, ensure that the right women at the right time get to the right care. All of this through an intuitive colposcope, a cloud-based system, and a set of services that integrate directly into existing workflows. So just to summarize, it's a simple 510K clear device with a portal that enables you to view any patient anywhere in your network, and a set of services to connect between providers to ensure that no matter the level of the provider, if that provider requires preceptorship, support, if that provider needs to know where to send a patient, but at that moment is not aware of the changes within a health system, that they receive the workflow support that they need. And that's why Cheryl Gibson, the Chief Medical Officer of Afaxis, has said that this is the innovation that she's seen that can make telemedicine and tele-enabled services finally affordable to every clinic across America. Now, we're very fortunate to work with over 40 health systems, some that are represented in this room, in over 23 states, seeing tens of thousands of women on a regular basis. And I'm here today because our mission is to save as many lives as quickly as possible. I'm here today because I can't do that without working with you. And so I would love to work with every one of your institutions to ensure that every one of your providers at every primary health clinic, at every point of care, can see as many patients as affordably as possible so that no patient is lost to the system. That's my personal phone number. Text me, call me, it's my email. There's no way I'll be able to meet every one of you during the summit. This is what we do day in, day out, and this is what you do day in, day out. It would be an honor to work with you to extend care to every woman across this country. Thank you.
Thank you, Ariel. Awesome, well done. Quick question for you. So I was struck by the axiom, all of us are smarter than any of us, as you were speaking, and you saw earlier I used the metaphor of a slide.
Yep.
Is there one particular point in terms of adoption where it's a little bit sticky that if you could just solve?
Yeah. Well, absolutely. So one of the challenges that we're facing right now, which is a good challenge to have, is that while we do have the largest database of cervical cases in the world at this point, we work with the National Cancer Institute as their base technology for their multi-center trials and so on, the machine learning that we do is not smart enough to be able to help provide that risk stratification at the point of care. So we require experts. So if we're working with MD Anderson, we require their experts to be able to review images on their cell phones while their clinicians are working in the field. And so if we could overcome that barrier, we can put more experts on the network to review more patients, to support more providers, to enable that preceptorship, that mentorship, that advanced practice nurses and general practitioners need to conduct those examinations. I think that we could do a tremendous amount to solve cancers that can be caught early enough to treat.
Thank you so much. Panel.
Yeah, so I'll follow up on that. Have you had problems finding the experts who are willing to adopt this technology and actually work with you with this to be able to do that?
No, we have not. I mean, thank God. You know, we work with the leaderships of the American Society of Colposcopists and Cervical Pathologists, with the Nurse Practitioners for Women's Health, the National Cancer Institute. I mean, across the board, we've been very fortunate from that perspective, but they are limited in time. And so the more that we can bring in, the more gynecologists we can bring into the network to support more nurse practitioners, advanced practice nurses, physician assistants, and so on, who know how to conduct pelvic examinations, but need that extra support, the more women that we can help cure.
And staying with that theme, what's the professional reimbursement model? The pro fee of the person doing the colposcopy, they get paid to do it, and then is the expert who reads it, is that a second bill or has yet to be determined?
Well, so it's an FDA 510(k) device, so the reimbursement for the colposcopy is the same so long as that person is certified to conduct the colposcopy. And the mentorship, the preceptorship is required by the professional association. So right now we have a doctor, for example, in Philadelphia that conduct examinations, and for every examination that he receives support on, pays through Venmo at this point, $30 to a clinician that's about 3 states away.
So who are you marketing that device to? The gynecologist, the primary care physician, the expert, the materials? Who are you trying to sell that to?
Currently, our largest customer base are hospital systems that recognize that it is very challenging for them to leverage their expert gynecologists for colposcopies. And so they end up buying, they start with one, so Northwell's a good example. They'll start with 1, and then they'll go to 13, and they expand out their ability to provide services to the point of care, as opposed to having to send women hours in order to get to that expert and sit on queues for that amount of time.
Are there other diseases in your R&D pipeline that you're looking at adding into this technology?
Yeah,
so what does that pipeline look like?
Yeah, absolutely. So right now we have colposcopy out in the field. ENT is soft launch. It's used right now in 3 states. Oral is in prototype. It's in the clinic, but it's not yet being used commercially. And skin is the next one, which we're actually developing with a partner out in Australia. Any visual-based inspection in the end can go onto our system. Our system, our aspiration is to build the architecture for engaging patients and providers around that point of care experience. And so where our expertise is in visual inspection, but that architecture of making sure that you know who you see, you know who you can talk to, you know where to send that patient, you know what happens to that patient, you bring them back into the system when you need them. You can do so much once you have that connected, right? I mean, the thing that fascinated me when I started learning about healthcare is that all of these discrete points of interaction are not linked, but the person has to go from one point to the other point to the other point, and those breakages between those discrete points are oftentimes when care fails. And so if we can just link them, if we can just connect them, if we just enable people to work together, we can save untold more lives.
So to that point, and I credit you for addressing the need here at home first, but putting the reimbursement issue aside, have you given thought to deploying this in a 3rd world country where the need is exponentially greater?
So we're actually working 26 countries around the world. We work in India with Apollo Health System, Max Fortis, which is the largest private health systems almost on the planet, across Africa in 9 countries with American teaching hospitals that then go abroad. So MD Anderson in Mozambique and El Salvador and Guatemala, with Scripps in Afghanistan. This technology enabled the first cervical cancer screening program in Afghanistan because Scripps and the Rotary Club sent out a bunch to Jalalabad and started training midwives to use it, and in doing so detect early cases of cervical cancer, and on.
Ariel, thank you so much.
Thank you. It's a pleasure. Thank you very much. Thank you.
All right. So in just a moment, all 4 companies will find out which one you, that's the folks in the audience, the folks watching on stream, chose as our 2017 winner. So without further ado, the moment we've all been waiting for, it's time to vote. Again, remember to consult the cards that were on your chair when you came in and vote based on the perspective of that card. If a patient, a healthcare provider, hospital purchasing committee, or investor. Use the criteria on your card to vote for the company you believe best fits the scenario. Just like before, you're going to send a code to vote via text 22333. Okay, you ready? Okay, phones out for a sec. Here we go. For Brainstem Biometrics, text BB001. For Magnolia Medical, text MA002. For Mighty Oak Medical, text MM003. And for Mobile ODT, text MB004. We're going to get back to the results in just a moment, but while the voting results are being tabulated, I'd like to say thank you to those that made today possible. First of all, for all of you and your participation in this week's summit. To our panelists for their time and their expertise and their insights. You guys, 2 zingers, I counted 2 zingers. And to Crystal Mullis, my friend Crystal, and the whole Vizient team for their continued commitment to the innovation in healthcare. This has been such an honor, and what a great day. We've kept up the momentum in a big way. Now, don't forget to stop by the Innovative Technology Exchange tomorrow to meet all 4 of these amazing innovators, along with hundreds of other suppliers, and with fascinating innovations to share with you. In fact, it's so important that we hear your feedback on those innovations. We want to make sure you're ready. Are you having fun using your phones to vote? I hope so, because there's more of that coming tomorrow. Take a look at how you'll be able to provide a quick feedback using your mobile device using the exchange.
Innovative solutions. Products to challenge the conventional. The future of healthcare. And we need you to be a part of it. Your feedback about the innovative solutions you experience here will make a difference. Improving healthcare starts with you. Here's how it works. First, if you haven't already, download the Vizient Events app to your mobile device. The password is Momentum 2017. Next, click Allow for notifications. Then, click on the app, and then click on the QR scanner within the app. For the product you're surveying, find the QR code. Using the mobile device, hover the camera over the product's QR code. The camera will automatically take a snapshot of the code. Click Follow Link, and the survey will open on your device. Complete the survey and then repeat the process with another product. That's it. 3 hours to review over 200 products. If you need any help, please go to the information desk and find a staff member in a Summit shirt, and that person can help you download the app. Thank you for providing us with your feedback, and have a great time.
We started by talking about a slide where you started with an insight, then you had an idea, then you had a prototype, then you got funding, and then you got people to believe in you, then you did a launch, and then you made a big splash, and it is awesome. So you are about to see a big splash. Let's get down to it. Let's welcome back to the stage the 4 representatives who shared their innovations with us. Come on out, gang. Come on, give them a round of applause. It's hard being up here in front of all of you. Good job. Okay, the moment's here. You, the voting audience, have spoken. The time is now, and remember, in just a second, we'll show you the polling data. Crystal, the envelope, please. Somebody, the envelope, please. Thank you. Good luck. Okay, the winner of the 2017 Vizient Innovation Challenge is, you guys want to do the, okay, good. And the winner is Mobile ODT. Round of applause. Well done, really well done. Excellent. Oh, cue the giant check.
That's a big check. I don't know if I can take that back.
That's awesome.
Congratulations. Congratulations. Okay.
Have you ever gotten a giant check before? That's amazing. Yeah, cash it. Run it to a Chase machine. Just take a picture. All right, stay. Why isn't this working? Okay. Aren't you dying to see the polling results? Let's take a look. Wow. Everyone did really well. That is really cool. I want to thank you for doing such a great job. Your job is complete. So a big thanks to the panelists. Give a round of applause to the panelists one more time. And before you go, audience, a few final comments from Vizient's own Byron Jobe. Byron,
Yeah,
your ball.
fine.
Thank you.
Thanks. Great job. Another hand for the group. I want to congratulate our winner, Mobile ODT. They did a great job. I think all the companies did a great job. Such amazing technologies. In fact, one of the things I was thinking while I was up here is, despite all the challenges in healthcare today, increasing cost or aging population, all the challenges in DC, that really got me motivated to realize that with the new technologies that are coming into our market, that's a promise for us, right? We can see some of the opportunities ahead of us to really change healthcare, to improve outcomes, reduce costs, and that's just, we know that what we saw today is a fraction of what's going on in our industry. So that's really exciting. We should all feel really good about that as we as we go home back to our day-to-day jobs. You know, it really does provide a spirit and an inspiration to all of us. And I just want to say thanks again to Mike for sharing his innovative vision with us today and emceeing our challenge. Now, as you can see, we had a theme for today around innovation. And as changes do continue to be part of the healthcare landscape, it's more important than ever that we work together to come up with truly groundbreaking ways to approach those challenges and finding solutions. And that's what our Connection Summit this week is all about. And finally, a special thank you to the sponsors who helped us make this conference possible. They're all up here behind me. They really did quite a bit to contribute to this effort today, and really for the conference. And again, don't forget to download your app. It can help you personalize your agenda, find session details, and connect with other attendees throughout the summit this week. I also want to give you all an idea of what you can expect next. So first of all, tomorrow morning, breakfast starts at 6:45 a.m. in the Four Seasons Ballroom. And we're also offering